Hello and a good day to all of you. Welcome to another episode of Speakspire with Sajee, where your story becomes the spark that inspires the world. We are coming to you from Walter J Studios here at FinTV Los Angeles, where you can watch us on channel 31.7. It's free to air. Also, you can tune in via LG, Apple, Samsung, Sony, Amazon, Roku, and Hulu. Catch us every week on FinTV. Today, we have a beautiful and a gorgeous young doctor that's here with us. Dr. Nayomi Ekanayake, who is a general dentist at Dentist of South Pasadena, where she provides comprehensive patient-centered care with focus on precision, comfort, and lasting results. Dr. Nayomi, welcome to our studio.
Thank you so much.
We are indeed proud to have you here today with us. And I know that you were born in Sri Lanka, but you studied in Japan at some point, and you have pretty much traveled at a very young age, and now you're here in the United States. So we would like to start off by hearing a little bit about your childhood.
I was born in Sri Lanka. But age 6 months, about 6 months, my family decided to move to Japan. Since my dad went to college in Japan, and he decided to just all of us live there in Japan. So I lived there for about 11 years. I went to school. I studied everything in Japanese. I didn't know English or Sinhalese. However, my parents, they both spoke to each other in Sinhalese. So I would hear them speak in Sinhalese, but I would not speak at all in Japan because, I wanted to be part of Japanese kids. I didn't want to speak any other language.
Right.
So for the first 11 years of my life, I grew up just speaking Japanese, studying Japanese, act like a Japanese person, but even though I was not, definitely, I was very brown and in the middle of a bunch of Japanese kids.
No, I think you could blend very well with them, you know?
Yeah. But it was a very good experience. And when I turned 11, my parents decided that we should move to Sri Lanka because I'm a brown Sri Lankan girl living in Japan, know nothing about Sri Lanka, know nothing about my religion, nothing about my culture. So they decided that we should move to Sri Lanka at age 11.
Okay. So how was it for you moving from, a completely different culture back again to Sri Lanka? I mean, you would have had to start from scratch over there because it's not many people would know Japanese to speak with you or to communicate with you, right?
Yeah.
So
it wasn't that great, to be honest.
I bet.
It wasn't that great. I only knew Japanese, but since my parents spoke in Sinhalese, I knew a little bit of Sinhalese. But my parents, they just wanted to give me a hard time, I guess. They decided to put me in an English school. It called international school.
Right.
So I had to study in English where I knew a little bit of Sinhalese. I was fluent in Japanese. I knew a little bit of English. So at 6th grade, when I started in international school, it was just everything was in English. I was so confused. I had to stay in 6th grade for 2 years. Yeah, I repeated 6th grade for 2 years because of the language barrier.
Right.
And then eventually I was able to catch up to the level of other students at my age. And once I turned, I was grade 8, I was about to go to be grade 8. My mom decided that she should put me in a public Sinhalese school. So then I went to Candy Girls High School.
Okay.
Where I studied both Sinhalese and English.
Right.
So now again, I had to learn a new language. Even though I knew Sinhalese, I didn't know it to a point where I had to study Sinhalese, like read and write, like literature. Because if you're taking O-levels in Sri Lanka, you have to take Sinhalese literature. So, and Buddhism in Sinhalese. So, and history in Sinhalese.
Right.
I was English medium, but I studied only like math, science. That was the only 2 subjects that was English. Everything else was pretty much Sinhalese. So definitely it was a struggle, but I made it through.
Right.
I passed O levels, and then we got good news from my uncle that we got green card. So we decided that we'd come here when I was 19.
Wow, okay.
Yeah.
So from Japan to Sri Lanka and from Sri Lanka to United States
Yes.
of America, you made your way here.
Yeah.
So how was that transition?
So coming from Sri Lanka to here, I already knew English since it was English medium.
Right.
It wasn't hard in terms of language barrier.
Right.
Maybe culturally a little bit to get used to the American ways. But I adapted pretty quickly here, surprisingly. The only thing is that I had to work full time. My father was he was not able to work. He was diagnosed with early onset dementia.
Oh,
So I had to kind of take the lead and take the role of household and work full time while going to school. First, I started from Pasadena City College.
Right.
And then I was taking classes, working full time. And yeah, my schedule was pretty
Tight.
hard. Yeah.
Right. So how would you describe that experience during your your school days here in California?
Looking back, I had to really applaud my 19-year-old self because I don't know how she did it.
You did great.
Now I'm 33. I cannot believe doing the same thing when I was 19.
Right.
I would wake up, go to class at 7 a.m. to 9 a.m. and then go to work at 9:30 and work until 6 and then do homework until 12. I would do that over and over again for days. And there are times that I took classes in the night and the morning. It was tough, definitely.
Right. Yeah, I bet. And definitely our program works with the motive of wanting to inspire youngsters, inspire anyone basically that's watching us from worldwide, right? Mm-hmm. And I think you are already inspiring everyone with your story. That's so true to a lot of people right now. I'm sure a lot of people can relate to that because when you move from Sri Lanka or from any other country to the United States, you have to start from scratch. You have to find your path. You have to work hard. It's not easy. So it's truly inspiring to hear your story and how you have worked so hard and now you have become a doctor, and it's quite inspiring for all the youngsters and for all the Sri Lankans and non-Sri Lankans that are tuning to us from everywhere around the world, right? So, Doctor, I know that you earned your biochemistry degree from UCLA and your DDS from Herman Ostrow School of Dentistry, USC. How did those experiences prepare you for your career today?
So, going to UCLA, I didn't know anything about what I want to do. I knew that I wanted to be in healthcare. I was confused between whether I want to go to medical school or dental school wasn't in the picture back then. I discovered after UCLA that I wanted to do dentistry during my gap year. USC is definitely a great school that prepared me to be a really good clinician. The training is really, really good, where we have to volunteer in several clinics, home shelters in Skid Row, to going to schools in mobile clinic, and that experience really shaped my skills in dentistry. And when I graduated this year in May, I was very confident in doing dentistry.
Right.
But what shaped me on becoming a good clinician as a healthcare professional and a dentist is also my experience in working. I had several jobs in my 20s where I work as a clinical data specialist, I work as a special coordinators, a special project coordinators, and I also worked in tutoring and I was working on a project where I was tutoring chemistry to blind students, and those little experiences shaped who I am as a whole, and my hardships and all the hard work that I put in made me more empathetic towards people. So when I talk to patients, I really try to listen to them and what their problems are. So a lot of the time, my skills in dentistry is just not the dental skill, but also talking to people and put myself in their shoes and try to understand what they're going through.
Right, which is amazing, which is something that we lack, because nowadays it's more like everybody's after money, right? So there's no humanity, there's no kindness, and like you said, there's no empathy. So you don't really see someone trying to like feel what you're going through when they have to go ahead and take care of your needs and your problems. So now that you are practicing as a dentist, how is it, what are some of the things or the characteristics that are helping you, doctor, to help your patients?
Definitely kindness. So I had to mentally prepare myself in the morning before I go to the clinic. I have to forget about me, and it's not about me anymore. It's about my patients. And I see many patients in a day. It's a busy clinic. So every patient I go in, I have to kind of understand their history, medical history, dental history, and of their personal history if they have. Just interacting with them, really have to mentally prepare in a sense. Like, it's not about me and it's about them, and it's time for me to listen to them, what their experiences are, and what type of treatments they need in order to better their oral health care, oral health.
Yeah, I think, I bet it's a lot to deal with, right? Especially if I ever go to the dentist, I go when I'm in severe pain. So how do you get to deal with all these patients that come to you crying in pain and,
I guess a lot of people don't like the dentist.
Right. Especially starting from kids.
Yeah, especially. Some kids are good, some are not. They have bad experiences and they were feeling the pain when they were going through treatment. And there can be several reasons in dentistry, but I would say like it's always important to go to a dentist and prevent any cavities or any infections from getting worse, because once you have pain, that means it has gone to a point that it's pretty late.
Right.
That requires more expensive treatment and more pain. So going early to the dentist and make sure that everything is clear, I think that's the important part. But I understand that a lot of people have trauma and doesn't like to go to dentist. And also money is a big thing in dentistry. It's very expensive.
Expensive, correct. And also I think people having this phobia, right? Going to the dentist is going to be a scary thing. So what is your take on that?
I personally loved going to the dentist since I was little. So I don't know what it feels like to be scared. But it depends on the experience. Every individual human beings and doctors, yes, every doctors are different. And they're human beings too. So sometimes a lot of patients likes me, but then there is going to be here and there patient that's not a cup of my tea. So I have to kind of navigate through what type of patient I like gonna like me and they agree with my treatment, and sometimes patients like I don't want to do this. Okay, and then so it's kind of still I'm navigating because I'm pretty new.
Right.
I've been working for 4 months now.
Okay.
But the last 2 years of school I spent seeing patients for 2 years. So technically I have like 2 years of experience seeing patients. But it's different. Everybody's different.
Right. So currently you're working at dentist of South Pasadena, doctor. So can you kind of walk us through a typical day in your workplace?
Yeah, so I have 3 different columns and when I see patients. Usually I have new patients, and I also have continuing care patients where they're coming back for treatments or cleaning, routine cleaning. And also sometimes I have limited care patients. New patients, usually I will greet them first because they are first time seeing me.
Right.
Continuous care patient, they have already seen me, so it's just continuing. However, I am seeing a lot of continuing care from other doctors because I'm taking over since I'm pretty new to that clinic. So I still introduce myself and say, hi, I'm Dr. Nayomi. I have to introduce myself as Dr. Nayomi. I don't think anybody can say Dr. Ekanayake. So Dr. Nayomi, and we would usually go over their x-rays with them, and also talk about what their routines and dental, like what do you floss, do you brush every day, and just go over step by step what they like what I see on the x-rays, and then slowly I kind of like tell them like what they need today or in near future, what type of treatment you need. And most of the time, if it's a cleaning, I would probably say, okay, you need this, but we need to do certain steps after that. But if they have a cavity, then I would try to kind of communicate with them, saying that it has to be done soon as possible, because once that cavity gets bigger and going to the nerve, then you need bigger procedures. So it's not that I'm trying to scare the patients, but we're trying to
that's the reality.
Yeah,
right?
that's the reality. So like we're trying to help them, but sometimes patients is like, no, I don't have a cavity. Yeah, so it's in denial. It's in denial. But yeah, but a lot of patients are great. I saw a patient yesterday, and he had a cavity, and I had to do a crown on him, and he was very happy about the crown that I did. The color matched, and it looked like a tooth that he had. It doesn't look like a different tooth at all. So yeah.
Doctor, I'm sure every day your life is extremely busy at the dentistry because you see a lot of patients. You said you have numerous amounts of patients that comes to see you. So how do you, in this realm, balance your work stress and your personal life?
That's a good question. I am still learning how to do it.
Right.
But I have gotten pretty good at it. I start my day pretty early. I wake up at 4:30 or sometimes 4, just to make myself mentally prepare for the day.
Right.
Because in order to care for others, I believe that I have to care for myself first.
Exactly.
So I go to work out, exercise at 5 a.m., making sure I'm physically, mentally taken care of.
Right.
So I can go to work and take care of others.
Right. And that's a great advice, I think, for any youngsters out there too. You are young yourself, and it is quite important to take care of yourself, because if you don't take care of yourself, you're not going to be able to care for others, right? So it's quite important, and that's a great point that you mentioned there. So do you ever get stressful while I work?
Yes, all the time.
Okay.
Like this Wednesday, I got stressed out. I had 6 patients waiting for me to see, and there was like a list of patients. Okay, I gotta go do this and talk to them, because I want to take my time and talk to them.
Right.
I don't want to just go room to room and rush through. And some treatment requires time. So
exactly.
A lot of the time, so I would tell the assistants, like, you need to help out. Could you just maybe talk to them, and maybe start with polishing them, because the assistants do some of the work.
Right.
Start whatever you can do until I get there.
Right.
And but even that, it can get stressful at times. Managing stress is not easy, but with time and experience and a lot of stress that you learn to endure, it kind of get better. You kind of come back really fast once you have experienced a lot of stress.
Right, because you are there helping out people, but then, there's a lot that you have to do on the other end as well. It's not just about the patients. You have a lot of paperwork, I assume, lots of other things that you need to attend to as a doctor. So balancing all those things, how does that help out with your work?
Balancing my personal life and the work life.
Right,
everything.
and the professional life.
The professional, because as a doctor, it's important to have good notes and making sure. One thing that being very, very careful about reviewing patients' medical history, making sure they don't have any medical issues, because sometimes anesthesia and drugs can interact with certain drugs that people take. So we have to make sure, talk to patients. I think talking to patients, definitely also listening to them kind of give me a little bit of a peace of mind just to listen to them. I don't have to do talking.
Right.
When I have a stressful day, I kind of go room to room and try to like listen to them, and that has helped managing stress. But in terms of out of work, like I get off, my hours are pretty long.
Right.
I start at 8, it was 9 sometimes, and ends at 6 and 7.
Oh, wow. Okay.
Yeah,
That is a long day.
Yeah, a long day, 7. And when I finish my notes, it would be like 7:30. So I go home. I just go to bed straight. I don't know. I know like a lot of people do things after work, but I just don't. But I do leave the weekends for myself to just go have dinner with my friends, or go out and just have some fun, and also like do hiking or just enjoy nature.
It's important for you to recuperate from your week's worth of, work and the stress that builds up with that.
Yeah.
So what do you usually do during your downtime?
Me and my friends, like my dental school friends, we work in the same company. So we would definitely go out for dinner together and kind of take pictures. We usually do it like once a month, and also occasionally we go to concerts just with friends. I also like working out on the weekends as well, in a group setting. So I meet people and interact with people instead of just like working out in the gym by myself. Like I do prefer the group setting, so I socialize at the same time.
Right, and the physical therapy, whatever you do to, find yourself therapy, it helps out.
Exactly, and also dentistry can have a lot of physical strain where like I have to always bend the neck and bend the back, so it's important that I take care of my body over the weekend. Right,
depending on the patient and the job that you're working on.
Yeah, definitely. Like if I'm working on a kid, they will be moving everywhere. I have to bend my neck is hurting end of the day. Or if I'm doing like extraction, pulling out tooth, that can take a lot of strength and
Yeah, hearing about the extractions give me
goosebumps. Yeah, sorry. I should not talk about anything like too much.
Whoa. So dentists are so big about, putting a smile on your face.
Yeah.
As a doctor, how rewarding is it for you when you see someone with a lovely smile? Now, when I say smile, it's not relatively to, the physical appearance of it, but you helping out a patient, and sometimes they are able to reward you with a big smile. And what does that do to you?
Definitely very rewarding. I think that's one of the reasons that like I chose dentistry. I always wanted to be a doctor, but specifically dentistry kind of gave me a sense where, okay, a lot of people don't like the dentist. Maybe I can make a difference. And yes, there's always going to be patients who still doesn't like dentists, but majority of the patients I see, they are very happy with the results, especially if you do any more cosmetic related or even like deep cleaning. They haven't had a dental cleaning in 5 years or 6 years, and they come back and I'm like, oh, like my mouth feels so clean, and they're so happy. And also if they're having a toothache, and I relieved of the toothache, and they're just happy. So definitely, I think smile is important. Teeth is important part of the face, to have a good smile, and just day-to-day life to have a happy life. So yeah, making a difference is definitely.
So are there any outstanding moments that you could think of that, you felt so rewarded and you felt so happy for having chosen this career?
Yeah, so many times. Actually, this was happening in dental school, where older lady who didn't have any teeth, she lost all her teeth, and I made her a denture. And as soon as she put in and smiled, and she almost cried, and she was so happy that she was able to smile, because before that she wasn't able to eat or smile. And her granddaughter was getting married, so she was so happy that she was able to go to the wedding with the full set on teeth.
Wow, that's very touchy. So I'm sure she was very happy. So doctor, how do you intend to learn and grow in your career in the future?
Yeah, so I learned so much techniques and clinical skills from school, and I'm pretty confident in doing 95% of the procedures.
Right.
One thing that I would like to expand on is veneers, like cosmetic and also implants. Implants is getting big now. Everybody, if you have missing teeth, implant is way to go, and it's technology that has really good success rate. So yeah, like in the future, I'm planning to go into more workshops and take CE courses to learn more on implants. And hopefully I can open my own practice someday down the line.
That's amazing news, and we wish you all the best and hope and pray you get to do that soon.
Hopefully,
so speaking of that means even though now you have done your studies, you become a dentist, your learning career doesn't really stop here,
It doesn't stop. I actually learn something new every month, because every patient's x-rays are different. I would see something different. We also have to know everything medical neck and up.
Right.
And if you see any lesion that's like suspicious, possible cancer, we have to know all those things. So we learn something every month. I'm learning something new every month. And even like years goes by, our technology is improving, and there's new technology. Crowns are made in clinics now. There's different materials coming up, so we have to keep educating ourselves every year.
Right. And so I'm sure even when it comes to dealing with all the new machines and the technology, right? It's a lot that you need to still keep up to pace with all those things as well in your industry.
Yeah. So, and it's a requirement for us, like any doctors, to take classes every year and to renew our license, to have certain number of classes done. So education never ends when you become a doctor.
Right. I think in certain parts of the world, once when you get your license, I believe that's it. But here you have to keep you have to keep continuing to learn more, keep yourself updated with the new rules and regulations, policies and procedures. So it's an ongoing affair, right?
It's ongoing, and new technology, new materials, new machines. Every year there's something new.
Right. So I know already we've been listening to your inspiring stories. What message would you like to share with any young Sri Lankan aspiring dentists, that are interested in taking over this profession? What can you tell them?
So I have noticed that there's not a lot of Sri Lankan dentists. I know one or two. Do you know any?
Actually, no. Other than you.
Okay, so I guess a lot of people, initially, before I became a dentist, my concern was like, man, I don't want to look at people's mouth all day, every day. But it's more than that. It's an art. Dentistry is an art. It's a combination of art and science. You have to be very delicate, and you have to be very artistic in order to do dentistry. So it's not just about looking at people's mouth. It's also changing life, because everything starts from mouth. Like we eat from mouth, a lot of things. So, and also, if you are good, if you love science but also very good at art, going into dentistry will be a good choice. And also for young people, Sri Lankan young people, I would like to say is that whatever you want to do, whether medicine or dentistry or pharmacy or anything, doesn't matter whatever you do, but important thing is believe in yourself, have faith, and make sure to have good work ethic, good routine, and just persevere. Any up and down you're going to go through, life is going to be hard. Becoming a doctor is not easy. It's a lot of studying, a lot of missing out on parties. Even though I didn't miss that much, I was managed to do both. But yeah, it's a lot of sacrifice financially, mentally, and physically. So, but if you have good work ethics, and if you have good perseverance and strong, and you believe in yourself, you can do it.
That's wonderful advice, doctor. So for people who don't have much care, that are, maybe less fortunate, how do you intend that they take care of their dental work and their dental plan?
Yeah, so I think people who doesn't have access to dentistry, it's a lot of the time, I think finances is an issue. There are a lot of free clinics. I really try to help much patient as possible financially, payment plans, discounts, whatever I can give. But there's so much I can do.
Exactly.
But it's important that I know this sounds going to be repetitive. Every dentist probably say the same thing, but just floss every day. That can change a lot of things. Because I can tell when someone is not flossing. It is important that if you have a cavity, that's probably because you didn't floss that area. That led to food impaction, bacteria accumulating, and it led to cavity. So if you're taking care of yourself, taking care of your teeth every day, that can prevent you from unnecessary root canals and extraction and all those procedures. So yeah, like for anyone who doesn't have access to dental work or doesn't have the financial means to do it, just start from flossing. And yeah, and if you have any problems dentistry already that needs treatments, go and get it treated immediately. And it's gonna be a good investment, even though it might be expensive. But there are also flea clinics. There's USC. They offer very discounted plans. So I think it's important
to know. Right?
Yeah, I also volunteer. Time to time, I do service days where I provide free dentistry. Time to time, I also go to Mexico. I went to Mexico last year, and this year I went to Guatemala to volunteer and do free dental care. So
that's amazing,
yeah.
Right? To be able to give back to the community, to help
definitely.
others, right? So
yeah.
That's simply amazing. And I think we got a wealth of information about dentistry and your dental hygiene, thanks to Dr. Nayomi Ekanayake, who joined us today. Doctor, what do you think of being able to be a part of this FinTV interview and being at the FinTV studios?
I think it's amazing that we have a channel to reach all the Sri Lankans in globally and kind of educate what's going on in different countries, and I think it's amazing that this channel was started.
So, Doctor, I've actually heard that you are quite fascinated in being able to go and serve our motherland, Sri Lanka. Is that true?
Yeah, I have always been fascinated to serve there. If I can have the opportunity to go there and serve.
I'm sure they would love to have you there.
Yeah,
you know?
I understand that there's already a dental world in Sri Lanka, but I believe that technology in America is pretty high. So I can maybe hopefully bring something from here, and I can also learn something from there. Actually, yeah, so since I mentioned it, my uncle is a dentist in Sri Lanka as well.
Right.
So
there you go. He can find you the path to, get there.
Maybe, yeah. I mean, I just graduated, so hopefully in the future I can go to Sri Lanka and do some dental work. Yeah.
To give back to the community, do a little bit of work there. It's always good exposure to be able to work in multiple countries, right?
Yeah, so, that's great, yeah.
And thank you so much, Dr. Nayomi, for joining us today. We were indeed privileged to have you here in our studio.
Thank you so much for having me. It was a pleasure to speak in this FinTV.
Thank you. Once again, thank you so much for joining us on Speakspire with Sajee. We hope to bring you another episode and see you next week.